Here are just a handful of slides on fibromyalgia. I'm going to include this because it's an unusual disease and you need to know something about it. It's reasonably common. Fibromyalgia is a clinical syndrome. What does that mean? A clinical syndrome is a disease which is characterized by common symptoms and signs. There's no blood test you can do. There's no biopsy you can take. There's no x-ray you can do. There's no study that can be done to diagnose fibromyalgia. It is a clinical diagnosis based on the patient's complaints and the physical findings. The disease is characterized by chronic, widespread, diffuse joint pain, fatigue, and tender points. So they're actually points at which you can press the patient's skin surface to elicit pain. There are also vague symptoms that are associated with the disease: increased sensitivity to touch. There doesn't seem to be any evidence of inflammation, so you don't see inflammation like you might see in arthritis. The patient has significant fatigue, sleep disturbances, and it is associated with anxiety and depression. So it's not known sort of the cause and effect, which came first, the chicken or the egg. We don't know whether anxiety and depression predispose patients to fibromyalgia or the reverse, or there's just some common link between them. So here's a representation of fibromyalgia, and the woman in the center of the screen that's spinning around there with the red dots, those are the trigger points, or the test points for sensitivity that you actually have to document to make a diagnosis of fibromyalgia. In addition to the points that are red in the spinning figure, there are actually what are called controlled points. At control points, you actually have to test those, and the patient can't have pain at those points. So again, very curious disease. We really don't understand it very well. You can see it's associated with a host of other problems that are represented on the slide as well. So you need to be familiar with those as well. Irritable bowel syndrome is another syndrome. So it's another disease that's characterized by clinical parameters, and there is no specific test for it. But there's quite a bit of overlap between irritable bowel syndrome and fibromyalgia. 80 to 90% of patients who have fibromyalgia are women. So certainly leads one to suspect that it might be related to hormones and hormone levels. The peak age of incidence is 30 to 50 years, but again, we don't know a lot about this disease. It is a clinical diagnosis, and you can discriminate between patients who have and don't have the disease, but it is not a disease that we understand well. And the symptoms can be debilitating. They're diffuse across the whole body. They can last for months and months, sometimes years. They're very prominent. The symptoms that cause the most debilitation, such as pain, trigger those tender points, and very, very profound fatigue. So there are scales that are used to determine the diagnosis, and those you don't need to memorize. You need to know that they exist. But they basically have to meet certain criteria to be considered having the disease or meeting the diagnosis. So pain being widespread, pain being severe, and then having a high combined score. The figure here shows you the tender points that are part of the diagnosis. And again, there are also control points. So you have to be able to push on certain control points that are not known to be tender points, and those have to be negative for tenderness.